have now more confidence in the financial market system to access this.
Well, thank you very much. I also have a question here from our Zoom platform that has been asked by Njoroge, and this is going to the Cabinet Secretary for Education, Professor George Magoha. I hope he's back in line. But before I do that, we have another question from our audience downstairs. Please go ahead and ask your question. Name your name, where you're from, and the person that you'd like to direct your question to.
Right. My name is Ben Kirera from K24 TV. And my question is directed to the Cabinet Secretary for Education, Professor George Magoha. And my question would be, we are looking at possible school reopening, as you have mentioned, in accordance to the trend of the pandemic, or rather the COVID-19 virus. And you have mentioned that provision of masks will be heeded to school-going children. Now, my question is regarding on how you're going to gain parent confidence for a parent who has seen the COVID-19 numbers rise exponentially over the past 5 months, and with even citizens putting on masks. So how are you going to tell these parents that my son is going to be safe in an overcrowded learning institution with only a face mask, coming from you as the CS, probably saying that social distancing will be an issue? Is it that you have exhausted measures to perhaps achieve social distancing that you can now say social distancing might be an issue? We have perhaps construction of infrastructure such as extra dormitories, extra classrooms, just to ease the burden of overcrowding in learning institutions. So basically, how are you planning to gain parent and student confidence once schools resume? Are we looking at a situation where parents might restrict their children from going to schools? Thank you.
All right, Professor, before you respond to that, there's also another question that is to be directed to Professor George Magoha, the CS for Education. Please remember, we'd like to know your name, where you're from, and who you'd like to direct the question to. I understand this question is to be directed to Professor George Magoha. Please go ahead.
Thank you very much. My name is Jafet Ochieng. I represent Standard Media Group. My question goes directly to the CS Education, Professor George Magoha. We realize that in some counties we have challenges with the WASH programs, facilities at the school level. As we discuss reopening of the same, are there plans in place to improve on the facilities that are currently there and improve on schools that have no capacity to provide water for their students? Thank you.
All right. I think, Professor, you can respond to those two questions.
I did not hear the second question, so you will have to repeat it for me to hear.
It was with regards to WASH and the WASH facilities around the country.
You mean the availability of water and the running water?
Yeah, probably. Jacob, you can respond. You can ask the question again for him.
If I may repeat, sorry for that, Professor. My question goes to the issue around WASH in schools, particularly schools in the rural sector. Now that we are discussing reopening of the schools, are there plans in place by the government to improve on the WASH facilities that are currently available in schools and also equip those schools that lack the same? Thank you.
All right. You got that now, Prof?
Yes, I think I did.
Okay.
And let me perhaps start with it because it is more direct. I think with regards to the availability of running water and WASH facilities, one of the things that the government has done is that we have mapped out all the schools. And what we mapped out first was to find out which schools have water storage facilities, and we were happily surprised that the majority of our schools, both in primary and secondary schools, have water storage facilities which have been purchased by government through the various local members of parliament. We also found out that there are a sizable number of schools with boreholes and others with running water. There are, however, some challenges with a reasonable number of schools where we have to think of, apart from harvesting rainwater and storing, how we are going to continue to maintain a good flow of water in those schools. And the government is dealing with those issues. That's not even the biggest issue. There are also some entities like the UNICEF which has been moving with us in identifying the most vulnerable schools and providing wash facilities from boreholes to piping, to what have you. In terms of dealing with COVID, it is not just running water. We have also inspected schools right now and seen that many schools have made reasonable strides with regards to providing facilities for the washing of hands and purchasing of sanitizers. Speaking as a physician, we are very careful to find out that the schools are not duped when you produce sanitizers that are not up to standard. So we keep on sending officers there to check. We are also aware that a small number of schools have been marooned with overflowing lakes like Lake Bogoria, Lake Baringo, and Lake Victoria. And my officers were there just last week, including Dr. Belio Kipsang and the Director of Secondary and Director of Primary School. Later this week, I will go to the ground myself to assess what is required. For the school that was destroyed completely in a place in Marakwet, the government has provided adequate funding and the school is being relocated and will be built afresh. If we are not ready by the time we open, the children will be transferred to other schools as a temporary measure. So we are very much aware that we have to make sure that there is running water in schools. The government of the Republic shall make sure that that happens. It's not a very big issue. On the first question, where, you know, the mind of a surgeon works like this. It's either black or white. There is no gray area. So I feel that it is important to tell Your Excellencies, the governors and other people, the truth as it is. As we move with every weapon that we have to increase physical space, let me take the boarding schools as an example. About 30 to 35% of our schools are boarding. And we should first of all commend government for ensuring that every child who deserves to be in school is in school. So if you go to a cubicle in a typical boarding house, you'll find 2 or 3 double decks, which will carry 6 children. If you have to apply social distancing, you can only take 2 of them at a time. So even in January, we shall not have built 3 times the capacity of the boarding houses. That is the truth, and I think it is better that it is known that way. Our hope was that in January, the requirement for the physical distancing may not be as important as it is now. So it is not that government is not aware, and the parents that you want to have confidence in government, they must have confidence in government that tells them the truth. The decision as to when to open the schools will depend on whether we have guaranteed the safety of the children. I've said that again and again. Nobody is going to ask a parent to take a child to school when we are not ready to guarantee their safety and that of the teachers. So everything depends on how the virus behaves, and you have seen it. You saw some schools in the United Kingdom where some children were able to go to school and some were wearing masks, some were not wearing masks. For us, we are going to insist that the children must wear masks all the time until such a time that we are sure that they can be safe. So it is not a situation of either this or that. We are moving together as a nation, hoping to solve the problem depending on the circumstances on the ground. If we are going to risk opening a little earlier, it would be for the examination classes where social distancing may be achieved. But that is after all the stakeholders have agreed that after they have done their exam, then what do you do with them? Because it will mean then that they have to wait for a year after doing the exams, especially the standard 8 ones, because the capacity to absorb the 500,000 when most of the schools already are over 100%, would be a challenge. So it is not my problem, it is everybody's problem, including the person asking the question, because he must be a parent or a related to a parent. Maybe Mr. Mayo, I can see you are there. They should allow you to help me to answer this one, because everybody has a stake in this one. It is not Magoha's problem, it is everybody's problem. And I think it's better to tell you the truth as it is, rather than sugarcoating. I submit, and please allow Dr. Mayo to add something to it.
Anyway, as we wait for Mr. Nicholas Mayo to get online, we also have a question that's coming from the governor of Nyandarua County. This is Governor Francis Kimemia. Governor, please get online and ask your question, and please say who you're directing the question to.
Can you hear me?
Yes, Honorable Kimemia, I can hear you.
Oh, thank you very much. I wanted to give my question to the Minister for Health.
Oh,
Minister for Health. Yes. But thank you very much, Mr. Magoha, because I know you have been able to manage the issue of the watchmen in the schools who had disappeared. And we are told they're now taking care of the schools. So I want to appreciate that one. But I wanted to raise the issue with the Minister for Health, in that we need to support most of our young people who have come up with innovations. As you know, in most of the counties, we are now making our own masks. We have PPEs with the University of Kimathi and Kenyatta University making our own ventilators. But we have a young man in Kenyatta University who was able to devise the smear, the corona pap smear, whatever you call the swab. And he required very little support. He has been able to be moved very, very far by the university plus the county of government of Nyandarua. We made a donation in the university, and I'm told it's the best in Africa and number 3 in the world. But we don't seem to be supporting our innovators, particularly the young people who have come out very, very, very handy in terms of preparing, coming up with masks, coming up with sanitizers, preparing soaps, educating people, the volunteerism that we have seen. If you could think about that issue, how to support such a young man in Africa who has been able to come up with the one of his type in the world, the first in Africa, I think that this would be a good celebration as we move forward. But I want to appreciate the issue of coming up with a CDC for Kenya. But I think even as Africans, I think this conference should also have looked at the initiatives that we can make as a region and also as an African, community. Can we be able to also come up with a CDC so that in the future, just in case we see we have a biological attack that targets Africans, could we be able to respond in research and development, put more money, which I support, and be able to defeat this kind of pandemics, or even a biological warfare. If it came targeting, say, a country like Kenya, you can be sure we are not prepared at all for a biological warfare, which this one came to attack the whole international community, so it didn't target Kenya. But these are the things, the fundamental things I thought we'd look at as we move on. Then for the Minister of Agriculture, I think the support we got as a county, we didn't see prices of milk or potatoes or cotton or tea or rice or foods grown across the country getting better pricing. We didn't see fertilizer coming up to support farmers. If this COVID had really taken on this country the way we have been told, I think we'd almost end up in a hunger situation in this country. So I don't think in terms of food security, even though there was that house we are told that was prepared, I don't think we are really ready for a major attack that comes and antagonizes the small-scale farmers on how we can be able to leverage our advantages as a country and be able to overcome. Because I think food and water security become very, very major threats for this country. So those are the points I wanted to make, moderator. I think there may be one other issue. I didn't hear us discuss the issue of the family. I think this COVID pandemic has really shown us that the family, our African family situation is quite volatile. We need to also get out of the FBOs to start addressing the challenges in the African family that just as you know, since COVID came in, we have seen that we have major challenges in the African family, and this need to be looked into. Whether it is gender violence, whether it is the children who are getting pregnant in the homes. We have FGMs coming. We have male circumcision coming up in December. We need to start strategizing very early so that we know how to handle these issues. Maybe I can stop there to give others. I know home-based care was not talked about. I think it did very well. So I think that these are some of the best practices I thought would also have picked as counties.
Thank
but
you.
as counties
much,
that
are farmers.
The
CS for Health, Mutahi Kagwe, is still online, and he has heard your first question, and especially now, even this last bit on home-based care and how the management of home-based care, the lessons that you've learned from that. I want to give CS Mutahi Kagwe just an opportunity to respond to that, to what you've heard, CS Mutahi, from the Nyandarua governor.
Thank you very much indeed. Thank you very much. First of all, thank you, Governor Kimemia, for very innovative and creative discussion. Let me just put it this way. There is a policy that we have adopted, and the policy is, as much as possible, we will go for local production of all items that we are dealing with. We started off with PPEs, which, as you know, and part of what forms the current controversy, were very expensive in March of this year, as they were in every part of the world. And it is true that we were buying those PPEs. In fact, initially, when I remember a few of them that actually came at 15,000 before they stabilized at 9,000. The rest of Africa was still buying those things at those prices when we started our local production and reduced them by more than 50% of the cost. And that is part of the innovation and part of the support for local production. We estimate that as we speak, there are probably some 5,000 people who are currently employed and working as a result of the fact that we started local production of PPEs, and we will continue to do that. But of course, there were people who had imported those PPEs. Some of them were not very happy about the fact that we stopped the purchase from KEMSA, and I instructed that that be the case, because there seems to be this notion that a CS is not supposed to talk to the CEOs. The second point, Governor Kimemia, that you raised us to do with the innovation of our young people. You will remember that when we started off, we were importing everything until Cambry actually started making the viral transport medium, or combining materials so that they are able to make the viral transport medium. I remember once when we had stopped for 2 days, no testing for 2 days, just because we did not have a VTR. So the VTM. So the innovation that we have seen has assisted us substantially. As we speak, Cambry has also now developed a rapid test kit, basically an antibody test. Obviously, going forward, this is something that they will scale upwards for use in the future. But on the issue of generally pharmaceutical products, there is one lesson that we have learned in this country. Number one is that you can have all the money in the world and you do not have the medicines and you do not have the commodities. And we experience that in a very graphic and illustrative manner. For example, the machines that we use at Cambry, a lot of them are American machines, essentially the Cobas machines that use only Roche reagents. And it was impossible for us to get Roche reagents. We instructed KEMSA to go and try and get Roche reagents from the manufacturers so that we can be able to be using our machines. And it was very, very difficult to do so, which means that even if we had the money, because the Americans were saying those reagents they are using for their own products, for their own people. We have got in this country gene expert machines, which we have not been able to use yet, and yet we have the machines. But we cannot, up to this day, 6 months from the start of this pandemic, 6 months from now, the Americans have yet to allow us to purchase gene expert reagents from the US for COVID-19. So you can have all the money, but you'll not have the products that you're looking for. At some point, we had to go diplomatically for diplomatic intervention to try and get India to allow for commodities for manufacture of pharmaceutical products, particularly related to malaria and HIV and so on. So what I'm saying is that we have to invest, we have to invite people to start local manufacturing of these things. We think that contract manufacturing is the way to go. And I warn here in advance, rest one day, I am then taken back to the dock for this reason. Some of these things may be more expensive than we can get from China. It may be 10–20% more expensive than we can get from China because of two things: the cost of production and also the scale of production that we are likely to see, at least initially. They can be a bit more expensive. But I suggest to all of us in this conference, it is better to be paying 10–20% more to a Kenyan manufacturer who is employing Kenyans, rather than import from overseas, transport all those jobs back there, transport all those taxes, and by the end of the day, if you did a cost-benefit analysis, you'll probably find that 10 or 20% more expensive is actually cheaper because of the taxes you are collecting, because of everything else that is happening to us. So I just wanted to flag that out, that as a nation, we have made that as a ministry and as a country, the president has directed that as much as possible, we do local manufacturing. That includes the possibility of vaccines, and we have distributed a list that is going to be gazetted through the Ministry of Industrialization that is going to inform what the products that we think can be made locally. These include the beds, these include things like trays, these things like little things that are used in theaters, even things like stands for, you find ourselves importing a tube stand, a stand that basically holds a tube so that you can treat a patient. There is no reason why those things should be imported. They might be a bit more expensive. And at that time, I am sure whoever will be minister will be accused of buying them at more expensive prices than they should. But that's not the point. The point is that we have got to do it in such a manner that it is transparent, it is clear, and it's a decision that we have made as a country. Finally, on the matter of home-based care, I think what I would like to do on this one, if you don't mind, Chair, is to ask Dr. Amoth, who is sitting right next to me, to mention something about it, because it has been one of the successful cases that we have led. It is something that last week the Global Fund heads were asking that post-COVID, they would like to learn how Kenya has done some of these things. And I'll give maybe if you allow Dr. Amoth 1 minute.
Well, yes, I thank you very much also, Dr. Amoth, for being here. But the next panel is actually going to talk about innovation, research, and cooperation. And that may also be a good opportunity for Dr. Amoth to come and respond and shed some light on what was happening in terms of home-based care. I wanted to thank you very much for joining us in this particular panel where we were discussing the impact of COVID-19 beyond health. My name is Eric Latif. I thank all the panelists who joined us this morning and this afternoon for sharing their insights onto this. The next panel is going to be discussing COVID-19 innovation, research, and cooperation, examining the role of research, data, and intergovernmental relations in COVID-19 response. And this will be moderated by Waihiga Maora, who I'm going to be ceding ground to. But as we do that, I'd like to leave you with a video, and this is Leave No One Behind, the experiences of vulnerable groups, that's women, GBV, refugees, children, youth, persons living with disabilities, and prisoners, innovations, buy and build Kenya, intergovernmental relations, and public-private partnerships. Thank you very much. Keep it right here because this conversation continues just after this short video. The next panel will be in place. Asanteni.
Fellow Kenyans, on Friday, March 6th of this year, the government of Kenya received confirmation of the first case of COVID-19, more commonly known as coronavirus.
The new frontier of this invisible enemy is increasingly shifting to the counties and to our rural areas.
All county governors are prepared and ready to deal with the pandemic.
More needs to be done, and the pace of this expansion should be increased in order to cope with the gradual shift of this pandemic to the counties.
It is important that each county strengthens its systems and ensure the facilities can provide the requisite services to respond to the disease as monitored by the Ministry of Health experts. In our previous statement, we reported that 26 counties have attained the minimum threshold of 300 bed capacity. We now have an additional 4 counties who have attained the threshold, bringing the total to 30. Cumulatively, in 46 counties, 3,970 tests have been carried out. County governments have continued to test workers attending COVID-19 patients after every 2 weeks. I urge all the FM stations, especially vernacular stations, to take this challenge and train Kenyans on home-based care the same way students are being tutored.
The National Reference Group on COVID-19 should also expand their ongoing work and establish the Kenya COVID Vaccine Consortium so that our research institutions, which are already doing great work, can now come together, bringing on board all relevant stakeholders locally, but also partnering with those internationally.
So therefore, as we fight this virus, as a government, we have started to harness the energy of our young people, engaging them in the National Hygiene Program that is more commonly now being referred to as Kazi Mtaani Initiative.
I'm so happy, I'm super excited. Kuna baridi lakini tunakazana, job ni mingi because of you. Thank you all so much. Tungefurahi sasa kama ingekuwa video call, nikuone. Alafu ninaomba walikuwa wamesema ati ni 11 days. But ungeongeza 11 zingine. Na ingine tungefurahi sana.
Sio kwa sababu ya kukataa, lakini najua tunataka kuhakikisha tumefikia vijana many as possible. Tukubaliane tu tuanze hivyo 11 days, alafu vijana wengine wafanye 11, alafu sasa wewe shiruku ni another 11.
Yes.
Ndio hii pesa tuweze kusambaza katika kila nyumba, katika matura moze.
How mono.
8,680 human resource staff have been recruited and already reported to their workstation in counties. Training of health workers has proved to be an effective measure towards the fighting against the coronavirus. Availability of essential medical supplies is key in responding to the virus. Medicine must be available, especially for individuals with underlying medical conditions. Nyumba Kumi initiative has proved to be so effective in disease surveillance system. Therefore, counties need to utilize this system for early detection, trade, and response. I would like to thank all development partners who deployed staff to the COVID-19 Secretariat. We appreciate the support extended to the counties.
The measures that we took are firm and indeed have been impactful. The nighttime curfew and the banning of travel in and out of the areas that have the most infections are indeed limiting the ability of the disease to be transmitted at a great scale. That if we work together, if we all understand that this problem needs all of us, and we all pull in the same direction, we will overcome.
Nobody can get. I'm saying like interesting at the back. Will you manage to get those shots? Yeah. Okay. Can you get here? Atasema kitu wote wawili. Yeye alafu His Excellency anafunga conference. I had already picked a few from the Zoom. Some people asking questions about data in the previous discussion, which I thought were more relevant for mine. Do you have Zoom there? Because now he's asked me to put my laptop down. I can put it back on. Yes, perfect. And then you just, when someone is speaking, you just need to do this to me, and I'll know I look at my phone. Is that okay? Yes, yeah. $250,153. Yeah. Umesema internet. The net has gone down. Well, we apologize for that technical hitch, but many thanks for staying with us for this COVID-19 virtual conference. We've been live from 9 a.m. in the morning. It truly has been a great program. So many insights, and of course, grateful to have had His Excellency the President opening this particular conference. And a bit later on, we will be hearing from His Excellency the Vice Chair of the Council of Governors, followed by the Chair of the Council of Governors, followed by His Excellency the Deputy President, and thereafter the President will close this particular conference. Now, my name is Wahiga Mora, a great honor to be moderating this conference today. And for this third and last panel that we'll be having on the conference, we'll be looking at innovation, research, and cooperation objectives. And of course, we are keen to examine the role that research, data, and intergovernmental relations have played in COVID-19 and the response since the pandemic first hit the country about 6 months ago. We'll also be taking in some of the questions from our panelists or from our audience who have joined us via Zoom and other platforms as well. But in the interest of time, let me quickly take you to the first session within panel 3 and introduce a topic, preparing for the future. And we'll be looking at leveraging on science and research in containing pandemics. We've got so much to learn in this particular area, and our scientists have been working hard on this, picking up lessons over the last 6 months. And let me introduce two of them now who shortly will be addressing you and talking about the lessons learned, possibly missed opportunities, and the way forward as well. Professor Omo Anzala, a virologist and immunologist with the University of Nairobi, will be speaking shortly on this. You probably have seen him speaking on TV on the same as well in regards to COVID-19 and the lessons learned. And a bit later on, we'll also be hearing from Dr. James Kariuki from the Kenya Medical Research Institute. Professor Anzala, I believe you're ready and raring to go to share with us a few lessons in which science and research can assist in combating pandemics. The stage is yours, Professor.
Internationally.
Cholera pandemic, 1899. The Spanish flu, 1918. The Hong Kong flu, 1968. SARS-CoV-1, 2003. MERS-CoV, 2012. And now SARS-CoV. What is this telling us? That these things are a recurring nature. If you look in the last 10 years, those of us who are in infectious diseases have been talking about disease X. Disease X is actually what we refer to as unknown unknown. And SARS-CoV actually that particular aspect of disease X. It's totally new disease. It's caused by a virus. It has, usually these have potential to become pandemics, and this has happened. High mortality, rapid spread, and usually there is no diagnosis, there is no treatment, and there is no vaccine. So as we speak, is a disease X in our lifetime. But from what I've just alluded, beginning with the Russian flu in 1899, it shows you that these things are going to happen. So the reflection from SARS-CoV-1, COVID, is that this outbreak can occur anywhere. All right, anywhere. It can infect anyone and kill anyone. It's airborne and droplet. And many people remain
Okay, Professor Anzala, my apologies for interrupting you. We do seem to have a challenge with your sound. I'll be coming back to you a bit later on, hopefully to get that very clearly, walking us through the history of pandemics, what lessons have been learned from the past, and I believe he was going to give us a conclusion in terms of the way forward. Very unfortunate we've had to do that, but let me quickly and immediately bring in Dr. James Kariuki at the Kenya Medical Research Institute to also share his views on how we can better prepare for the future, to educate, warn, and empower those on the ground should another pandemic ever come to the country. Dr. Kariuki, the stage is yours.
Thank you. Thank you so much, and to the organizers for giving me this opportunity to be able to share some insights on what we can learn from research going forward. as a situation analysis is that the Ministry of Health did very well to do what we call triangulation to inform decision making. And what I'm saying here is that it looked at data that was available. It asked the research questions, and there was a lot of synthesis of research evidence that came from previous experiences with other similar conditions. And then what has been Kenya's experience? The three angles were put together, and in a rapid mechanism, the Ministry of Health, the State Department, was actually able to respond to this pandemic from an evidence-informed decision-making perspective. In terms of going forward, very quick reflections here is that, number one, we need to strengthen the capabilities of the State Department and county governments' departments of health to undertake what we call rapid research synthesis mechanism, where you go back to literature and look at the existing knowledge, rapidly synthesize that and come up with smart recommendations. And although it exists, it requires to be heightened. It requires to be strengthened to be able to speak to the local situation and take notice. The second thing is that to the audience is that we don't lack knowledge. There is plenty of knowledge, but how to synthesize this knowledge and use it? That ability to use is where the issue is now coming in. We have public and private universities being able to generate a lot of evidence, but how do we use this evidence? That one is still an issue for us to explore. As a scientist, I can tell you one of the hallmarks or the excitement of a scientist is when the recommendations from primary and secondary research becomes or finds their way to policy, practice, and programming. This is a hallmark of a scientist, that it's a big contribution to the society. And therefore, one of the things we observed during the COVID is that a number of scientists became think tanks, and they were able to put their knowledge and synthesis, and the Ministry of Health and also the Council of Governors, they were able to take up these synthesis recommendations, and they were able to put forward a strong case. So the third thing is that adaptability of the findings. Most of the time, as researchers, we do make recommendations, but not all of them do find their way to policy, practice, and programming. They need to come up with smart recommendations, and also to request that there is a lot of local knowledge that is still there that needs to be synthesized. COVID-19 taught us the community at large, whether it's the academia, whether it's the research institution working together, there is a lot of local knowledge that can be harvested and learned and synthesized and repackaged to inform better decision making. These are my three areas. And one take-home message is that let's not be scared with new innovation, new technology. It's said that recommendations actually take about 3 years in Kenya to actually find their way or to be enacted by either local government or national government. We need to be like Rwanda, which takes very positive results, research findings. It takes Rwanda 30 days. Kenya, 3 years. Why? Because we are risk averse. Most of our managers are risk averse. And therefore, no matter how much the synthesis, the rapid synthesis output, if we are not able to use the research recommendations, they end up in the bookshelf, and somebody is also going to pick them somewhere. Remember, somebody said that if you cannot use it, don't do it. So let's use what there is. Let's take the risk and use what is locally available, because our students at the universities, they are generating credible research findings.
Okay. Dr. Kariuki, I'll have to ask you to make your final point, please.
My final point is this. Let's create a win-win situation for all of them. Strengthen the rapid research mechanism synthesis to take up the research, There is no one fit size to all the local health problems.
Mhm.
Research will still remain a continuous part. Thank you.
Dr. Kariuki, very insightful indeed. I think it really struck me when you spoke about us being a nation that's risk averse. Why is it in other countries something that would take a couple of days takes months for approval in this country? And it's time for scientists to think further on smart recommendations and adaptability of their recommendations to ensure that they are tested out in the real world and not just in labs. Well, earlier on, we were listening to Professor Anzala, Omo Anzala, immunologist, virologist at the University of Nairobi. I think we now have him on. If not, we'll be forced to continue with the next panel.
Okay. You can hear me now?
Yes, I can, Prof. Continue.
Yes. So the future, really, what we want to look at is that we were modeling and looking at case management and also looking at research. And what became apparent in this country is that there were just two things that were apparent. One, coordination. Two, issues of data. We have a lot of data in this country, but that data is scattered all over the ministries and very hard to get. So when we are modeling this outbreak, that was one of the major problems. So in the way forward, as I'm going to suggest, is that I would like us to put together some form of a coalition that will be responsible at One Health. And this will look at COVID now, but also look into the future. As I've said, I've given you a sense of where outbreaks are coming from. So this coalition, or as the minister said, Kenyan CDC, will be looking at virology and virology studies, to be looking at human-animal interface, because this is where the problems are. It will be looking at climate change, because climate is a big issue. It will be looking at vector adaptation, because I can tell you, we are beginning to see mosquitoes in places where there were no before. We are also beginning to see mosquitoes transmit infections that were not transmitting before. These are the information that we need for early warning signs. We want to look at epidemiology.
Okay, Prof, I'm going to have to cut you off there. And as I give you your last 30 seconds, please say something about the search for a vaccine that many are eagerly awaiting, even those who are watching this broadcast today.
Yes, the other aspect of this is that the issue is that we are not safe until all of us are safe. And all of us are going to be safe if we have a safe and effective vaccine. And I'm on record saying that Kenya should actually put together a COVID vaccine consortium that will actually look for funds. And these studies of vaccines must also be done here to ensure safety, to ensure efficacy before they are rolled out. So I'll stop there and wait for questions. Thank you.
Professor Anzala, Dr. Kariuki, great minds. I know we've not exhausted the wealth of knowledge that you have in the time that we have. Hopefully we'll get one or two more of your thoughts via questions. But let me immediately take you to the next session, and we'll be focusing on from data to action. How can we leverage on data to respond to the challenges that we've seen in COVID-19 and the disruption that it's brought about, from the allocation of medical resources to economic recovery policies as well? What role does data play in all this? And I'll be having two speakers on this next session. Dr. Kama Rogo, who's a health expert, will be the first speaker, followed by Mr. MacDonald George Obudho, who is a director of population and social statistics at the Kenya National Bureau of Statistics. And of course, remember, you can weigh in on this discussion online as well. The hashtag is COVID-19 Conference KE. We're at Council of Governors on all social media platforms, and we'll try and take some of your feedback as well. But Dr. Rogo, I believe you're ready. Please talk to us a little bit about how to move from data to action. You have 5 minutes. Please proceed.
Thank you, Waigo. I'm addressing you from the village, so I hope that the internet holds. Data is the new currency for managing health and managing development. So if you don't have a data, you're not managing anything. A couple of years ago, addressing 300 top Kenyan health researchers in Naivasha, I asked them in passing how many of them, by show of hands, had seen their research translated into policy or action. There was only one. Only one out of 300 top Kenyan researchers. We moved on further to find out why that was happening. And we identified 3 areas of major deficit that is going to plague our ability to move from research to action. ourselves and the confidence that our leaders have on us. It is easier for a research assistant sent by Gates Foundation to make his way to State House and meet the president than a senior researcher from Cambridge. That needs to be sorted out. 2, confidence deficit in local funding. Most of our research is funded by donors. The money that the government gives us research institutions goes into salaries. There's no point paying somebody a salary if he has no microscope and he has no reagents. But since these monies are coming from outside, we also have a third deficit, which is a deficit on focus and relevance. He who pays the piper calls the tune. So a lot of the research that we are doing is not to answer questions that are being asked by Wanjiku in the village, but brought in by the funder who is moderating everything. This brings us to the fourth deficit, which is a deficit in ownership. What you don't pay for, you don't own. So when the results come out, then who uses it? If you go to the Library of Conference Library in the US, you will find that a lot of work that is done in Kenya is being used out there. Kenyans don't even know about it. So who owns this thing? If we are fifth is a deficit creating new institutions.
Okay, Dr.
Rogo,
universities and so Dr. Rogo, you had warned us that you are live from the village. We seem to have a challenge with your sound. Let's try and get that sorted, and I'll give you another minute or so to wind up. You really were getting into some points I know a lot of Kenyans are concerned about. If data is a new currency, and if we have a lot of knowledge in this country, why is it not producing the results that many would like to see? Joining Dr. Kama Rogo to speak about from data to action is Mr. McDonald George Obudho, who's a director with the Population and National Statistics at the Kenya National Bureau of Statistics. Mr. Obudho, over to you.
Thank you so much, Bwana Waiga Mwaura, and good afternoon to all of the participants in this group. Now, from my discussion is essentially branching from the formation of the National Coordination Committee on the response of the coronavirus pandemic, which was done by the government, and from it, we had another committee, a subcommittee that was dealing with the national economic and business response. So when it comes to this, we actually require data for us to really see the impact of the COVID-19. And this is how the Bureau actually comes on board to ensure that data is available for informed decision making, including the policies and the interventions that the government and all other stakeholders would be having. So in this case, we actually had to conduct surveys on the impact of COVID-19. And one of the things that we had to do was to, first of all, come up with a frame which was not available before. Because the approach that this one required is that we could not reach people in person or the respondents in person. We had to depend on telephone for us to conduct the interviews. And that brought us to the conduct of a survey using the telephone, which is the computer-assisted telephone interview, the CATI. This is something that we have not done as a bureau before, but we had to develop a frame, which we did. And from it, we are able to come up with the questionnaires and get to understand what is it that is required of this activity for us to provide the same. So within it, we have been we were able to conduct 2 waves of the survey. It was done at the national level. Our interest was also to have it reported at the county level. Unfortunately, the sample size could not really allow us to do that. The same to urban rural. So 2 waves of this survey was done, and the key areas that we focused on to look at the impacts of the COVID-19 covered on the economic activities, that is work-related, then transport, the ease with which to get transport by then, and then education activities, rent, do you have ability to pay rent in full and in good time? If you are not able to pay in full, are you able to do it partially or not at all? Then, you know, that kind of information will really help stakeholders to decide on how best to help those who are in problems. Now, the others were based on the food security, knowledge of COVID-19, because you see now when the government is coming up with the publicity and intervention, it is necessary for the government actually to get to know to what extent have people gotten the information so that they are able to keep safe from this. And then came the coping mechanisms, which we had to look into details. How are people coping up with the education situation, food, lack of finances or enough finances, and even health related issues. Then there was also the element of the cash transfers and remittances, where we are looking at now when we have problems with within repayment of our loans. How do we negotiate with the banks and circles so that people are still are able to meet the obligations and also get a way of survival? And of course, at this point in time, there have been quite a bit of domestic violence, which we also tried to look at in our survey. Now, there are arrays of activities that indicators that we needed to generate. But of course, with the telephonic type of questionnaire, you cannot accommodate so much. So now the key thing is how well then is this kind of information utilized? That becomes the key thing. And of course, from the Bureau of Statistics, we ensure that our information is widely disseminated. Colleagues, I think if you go to our website, which is www.knbs.or.ke, you'll be able to see the 2 waves of the surveys that we have conducted in line with the COVID-19. So, but data is basically used, as I conclude, data is basically used to get to where we can now have interventions put in place by various players. It is also helpful when you're looking at the emerging issues. What is it that is likely to come up which was not there before? Then it is also helping develop the trends that can also help you get to see what is going to happen in future. And of course, lastly, it's about making informed decisions when you have the correct information. And this is what actually we stand for as a Bureau of Statistics. Thank you, Waiga Mwaura.
Thank you so much there, Mr. George Obudho MacDonald, of course, the Director of Population and Social Statistics, KNBS, talking a little bit about what data has shown them on coping mechanisms, food and finances at this time of the disruption brought about by COVID-19, cash transfers as well, and how data can be used to improve the lives of Kenyans. And of course, we did have Dr. Rogo on a bit earlier. He made quite some strong points. I don't know if we can still give him a minute or two if we have sorted his sound and clarity of signal. Dr. If you can hear me, you said that what you don't pay for, you don't own. Please continue from there.
6 deficit is a deficit in coordination. We have spoken about that, and Zala mentioned it. 7th deficit is a deficit in dissemination. We do not discuss, partly because most of it usually is in the hands of postgraduate get their promotion. Where that sits after that, nobody knows. The final deficit is a deficit in the will to implement change. The way government is run right now is to maintain the status quo, not to change. And transformation requires change. So people don't take time to look at what is new and what can we do differently and what does it cost to do it differently. I'll very quickly focus on areas that we must change if we are to move forward. First of all, our research must be relevant to our communities, to the leadership, and must be related to policy. But we have missed opportunities in many areas. The first is that we have missed opportunities in the data that we collect. In health, most data is routine data. We are collecting data when you see your patient as a doctor. You're collecting data when a nurse takes your blood pressure and so on. Where does this data go? Nowhere. It is rotting in the stores here. If we can't collect data, analyze it, and use it, let us not expect that some scientists some the answers that are relevant to us. Secondly, in between counties
it is.
and between counties and the center. We are not clear right now how Emory, for example, ought to be coordinating those areas.
Okay, Dr. Rogo, I'll have to interrupt you there. We do have a challenge with your signal once again, but some pertinent points that you're bringing. First, you gave us 7 deficits that data has revealed, even as Kenya dealt with this pandemic, and you are looking at what must be done. Research must be relevant, related to policy. What missed opportunities might we have had as doctors study patients, collect data that he feels might, by far and wide, rotted in stores instead of being used to actually create solutions. And a very strong point that he brought up much earlier on: is it easier for a research assistant from a foreign company to access some of our key decision makers in this country as compared to a Kenyan scientist? Food for thought. That topic was from Data to Action, and we just heard from Dr. Kama Rogo, a health expert, together with the numbers man, Mr. McDonald, George Obudho, who's a director of population and social statistics at the Kenya National Bureau of Statistics. In the interest of time, I'll take you immediately to our next panel, which is focusing on harnessing innovation in a pandemic. Some good news out of a pandemic, sustaining opportunities, because they say out there, for all the misery caused by the COVID-19 pandemic, one legacy that it will have left us with is technological innovation. You've heard about what's happening in various universities. Kenyatta University really standing out with the ventilator technology that they came up with. You've heard about what's happening out there with engineers coming up with all sorts of solutions, from hand washing and even globally software solutions to help with contact tracing, social distancing, and so forth. What can we do to ensure that these solutions are not just for here and now, but can be used to sort of spur forward some sort of a new boom of innovation in this country and entrepreneurship as well? And joining me are the experts to talk a little bit about this. We have Honorable Betty Maina, Cabinet Secretary, Ministry of Industrialization, Trade and Enterprise Development. We'll be listening to her shortly, together with Ben Roberts, Vice Chair, ICT Sector Board, and the Kenya Private Sector Alliance. Let me start with Honorable Betty Maina and allow her to share a little bit on the innovations that she's obviously seen so far, lessons learned, and the way forward.
Thank you very much, Wahiga, and my thanks to the Council of Governors for putting this session together and inviting us to join. It's been a long day, and a lot of what you want us to speak about has actually been referred to by earlier speakers, starting with His Excellency with his opening remarks. I think we've all noted that we've had to respond to this COVID pandemic in ways we hadn't anticipated before, because we obviously didn't know that it was coming, even if the scientists among us tell us that it was always going, something like this was always going to come, and something else will still come after this. I think one of the things we have noted with the disruption of global supply chains that we've had to turn to ourselves to supply a lot of needed commodities. So I don't think I want to speak so much more about, but we can probably highlight the fact that we are extremely proud that we've been able to supply a lot of needed commodities within Kenya. PPEs, face masks, and all those have been mentioned, and I'm really very proud of Kenyan industry and how from the from Nairobi to the littlest market in many of our places, people can now produce these commodities, and it's available in abundant supply, and it is also fairly inexpensive. We've been asked before, why could we not do this before? I do not know. I think because we didn't need to, and we didn't probably trust ourselves to be able to do this. But I'm proud of the fact that we're now able to produce those things. We've also gone into production of ventilators, and the ventilators that were showcased, and we saw the prototypes, are now available for clinical trials, and we are hopeful that the medical practitioners amongst us will certify these so that they can go into mass production. But there have also been other innovations in Kenya. We've seen production, for instance, of digital thermometers, the ones that take temperatures, so that are also being produced in Kenya currently, and we have possibilities of producing other things with our locally assembled motherboards. So there's great possibilities in that regard. With regard to sanitation, we've seen a lot of innovation with hands-free hand washing facilities that are being produced by our informal sector. We've seen production of other medical stuff like beds by our Juakali sector. So I'm quite excited that that would go and that we would see much more of that in future. So turning now to the bigger question on how can we sustain this innovation beyond the COVID time. As mentioned by the Minister for Health, one of the ways of sustaining this sort of innovation is by creation of a market. The government has made it its duty to buy what is locally available, whether it is the masks and PPEs, the sanitizers and other goods. We recently published a list of goods, about 334 goods that will be solely purchased by the government from local producers, and that should be able to create the stable market for these innovations to establish themselves in the economy. The second thing that we must also keep investing in greater education, because we will realize more. The researchers on this team has talked a lot about our research capacity, but this capacity, we need to keep enhancing it, and therefore our education system needs to harness innovation and really stimulate innovation, because it's not going to be, as we create a market for products, it should be products that are wholly generated within this, innovated and generated within this market.
So yes, Maina, allow me to interrupt you so that you can give your final comment. Unfortunately, we're out of time.
Thank you. So I'm actually coming to the last one. So as we create the market for these products, and as we emphasize this in education, need to be aligned to supporting innovation and supporting this research coming to fruition, and therefore a lot of venture capital is required, and we need to really work within our financial system to support the innovators turn their goods into commercial production. Thank you very much.
Thank you there. We've had Honorable Betty Maina, Cabinet Secretary, Ministry of Industrialization, Trade and Enterprise Development. I'm sure there'll be many questions for her. Some I'm already seeing coming in via our Zoom platform, and I will quickly try and look for some space at the end of this panel to be able to get that to her. She's spoken about all of the innovation that we've seen over the last couple of months, from ventilators that are at various levels of testing, thermometers, sanitation equipment, hands-free equipment as well, and really just looking at how this can be a sustainable long-term approach to entrepreneurship and innovation in this country. And just straight on the back of that, we are also joined by Ben Roberts, Vice Chair, ICT Sector Board, and the Kenya Private Sector Alliance. And even as you come in, Ben Roberts, an interesting comment from a previous panelist that I want to read. This was from Dr. James Kariuki from Kemri, who said, "There's no shortage of knowledge in this country, but it takes 3 years for Kenya to implement credible policy research, unlike other countries in East Africa." Rwanda was mentioned as one of them, which could take possibly 3 months. So, Ben, I apologize if I'm putting you on the spot. Within your submissions, if that's something you can also mention, we will appreciate. Go ahead. Okay, Ben, we seem to have a challenge with your sound. Just hang on there shortly. I'll have to ask you to start again. And we will be able to listen to you. That's Ben Roberts there, Vice Chair, ICT Sector Board, Kenya Private Sector Alliance, just coming up off the back of some comments from Honorable Betty Maina, Cabinet Secretary, Ministry of Industrialization, Trade and Enterprise Development. Remember, we are talking about harnessing innovation during a pandemic, but also sustaining opportunities beyond this season. Ben, I hope we now have you back online clearly. Let's give this another shot. Go ahead, Ben. Oh, it's unfortunate. It seems that we will have to bring Ben back on later when we're doing the question and answer session, because we now need to switch to the last session within this panel 3, and that is that we'll be looking at managing intergovernmental relations in a pandemic. And for this next session, we have 3 speakers. We'll be hearing from the Governor of Laikipia County, Honorable Nderito Mureithi. Thereafter, Honorable Eugene Wamalwa, who is the Cabinet Secretary in the Ministry of Devolution and Arid and Semi-Arid Lands, ASAL. And finally, Professor Karuti Kanyinga, Director for the Institute for Development Studies. Remember, you can weigh in on this conversation as well on our social media platforms. The hashtag COVID-19 Conference K is currently trending at number 2 in the country. Kenyans very interested in this particular topic, wanting to know what lessons have been learned, missed opportunities, but also what does the future look like as well.
Hello?
And the bevy of experts that we've had have been able to really speak to a wide cross-section of the issues that have to do with COVID-19. At this time, let me bring in the Governor of Laikipia County, Nderito Mureithi, talk to a little bit about how they have managed or what the challenges have been when it comes to managing intergovernmental relations during a pandemic. Governor, over to you.
Thank you. I think the 2 big points in terms of the relationship between county and national, and I think the main issue is often around resources and the speed at which resources are able to move to counties. As you know, we still clearly far away from where we should be. We do not have a county allocation in place, and therefore counties are not accessing their equitable share, which obviously hampers and constrains what we are able to do. In addition, of course, the resources that then go through Ministry of Health take quite a little bit of time. So the main point of improvement is to hasten, and in terms of where we are, which is a bit of a crisis point, is for the Senate to be able to conclude one way or other the conversations that are going on there, but also perhaps to use a safety valve, which would be vote on account, so that county governments are able to do our work. Over on just one additional point, Kahega, on the question of innovation and where we go from here, I think it's an issue of scale up, because ventilators, PPE, and so on, all these things are being produced. I think it really is a matter of us scaling up. And finally, to the point of healthcare financing, that as we move forward, we must reflect on how to improve. We have improved on the capacity side. We have to answer the question, beyond COVID, or even as we proceed with COVID, how do we improve healthcare financing? I thank you.
Thank you so much there. We've had the Governor of Laikipia County, Honorable Nderito Mureithi, speaking about managing resources during a pandemic. That has been a challenge, delayed disbursements, how to improve healthcare financing as well. And I'm sure some questions are going to be coming in on the back of that, because that's a discussion the country has been having for the last couple of months. Now, related to this topic, of course, a bit earlier on, we had been speaking with a Ben Roberts on managing innovations during a pandemic, and I'll give him a chance at the end of this session to be able to speak, but still staying with managing intergovernmental relations within a pandemic. Let me allow Honorable Eugene Wamalwa, the Cabinet Secretary in the Ministry of Devolution, to also weigh in, possibly respond to what Honorable Nderito Mureithi has had to say about the challenge of managing resources, delayed disbursements, challenges with healthcare financing that many governors are grappling with in the storm or in the midst of a pandemic. Honorable Wamalwa, over to you.
Thank you very much, Wahiga. And as I said at the beginning, during the opening ceremony, I did indicate that indeed the intergovernmental relations are at an all-time best. And looking at the theme of this conference, we are required to reflect on the past, as well as look at building a sustainable future. And looking at our past, in our 8 years experience of devolution, relations between the 2 levels of government have not always been this great. When we started, of course, we had an adversarial kind of relationship Those of you who would remember the first chair COG, Isaac Ruto, it was a tough relationship between the two levels of government. And when Peter Munya came, it was not easy. It was very combative. But with time, we are happy that we've come to realize that indeed the attitude is very important, how the two levels work together, in spite of the provisions of the law under Intergovernmental Relations Act number 2 of 2012, requiring the two levels to work together. But when we look at ourselves and we realize that we are no longer adversaries, but we are allies, we should not be protagonists. In fact, we should be partners. And we are not enemies, but enablers. Then we realize that we're also not competitors, but in fact, we complement each other. And we want to thank Governor Nanok, we want to thank Governor Oparanya, the current COG, who have worked very closely with His Excellency the President to ensure that we improve these intergovernmental relations. We work together more closely than before, and especially during this pandemic. As I said before, we've had more summits back to back, increasing consultations between the two levels of government, creating committees beyond what is provided for under the Intergovernmental Relations Act, where we have the COG, we have the summit, we have the GRTC, we also have the sectoral panels. Now we have more structures created. The 5 committees that we talked about, from the national coordination to the economic, to the food security, to national security. This has enabled us to work very closely together during this pandemic. We'd like, going forward, to see this strengthened. And as national government, we're already strengthening those structures. We have had amendments to the IGRTC Act to increase coordination between the two levels, where we have the cabinet with COG working together through a steering committee. So we're happy with this, but we know that there's room for improvement. Going forward, we need to continue working together more closely than before. Thank you very much.
Yes, thank you for those thoughts. And maybe just a quick question to you on the back of what Governor Nderitu had to say. And of course, you know, positive to hear that there are now more cordial relations between the national government and the county governments. But in the midst of all this, then, why would delayed disbursements be a reality? Because many would believe that when relations are fixed, that issues of resource allocation would not see the kind of delay that Governor Nderitu alluded to, at the beginning of his submissions. How would you respond to that specific query? Especially because these resources are for health, primarily for healthcare at a time like this.
Wahiga, this has always been a thorny issue, but I can say because of the improved relations, actually we're handling matters better. Instead of talking at each other, as we have been doing through the press and issuing very combative statements, because of improved relations, we've been able to achieve so much, talking to each other. And Governor Oparanya can attest to this. We've been able to get funds released. We know that even when the President directed 5 billion to be released through the Ministry of Health, there are those who are saying, no, that money is not provided for, it's not coming. But as we speak, each county has been able to receive their share of the 5 billion. We released another 1.4 billion under the KDSP program. Another 4.6 billion is coming. So with time, all these monies will come. Of course, there's been a stalemate at the Senate level. And we are urging the Senate to do their most sacred duty to ensure that that formula is in place so that resources can go to the counties. Counties are stretched, as I said, they are hurting, they need the money, and we must give them the necessary support. Thank you.
Thank you, CS Wamalwa, for responding to that question, and we'll see if there's 1 or 2 more questions for you at the end of this session. At this time, let me bring in the last speaker on this particular topic, managing intergovernmental relations in a pandemic, and at this time, Professor Karuti Kanyinga, who is a director with the Institute for Development Studies, will give his submissions. Prof, over to you.
Thank you very much, Waiga, and good afternoon, everyone. Let me pick from where the CS has left and improved a lot during the pandemic period. And for the first time, we have had summit meeting quite often because of the type of animosity that was there. But we need to start asking ourselves, how do we replicate what has happened? Because the crisis has been able to bring both governments together and address the suspicions and mistrust in the two levels of government. The reasons why there has been suspicions at this particular level is A, the national government sometimes tends to usurp responsibilities that belong to the county governments. Even at the beginning of the crisis, there was a tendency and a feeling that health sector was being managed by the national government rather than giving the county governments the autonomy that they require to address some of those challenges. Bwana CS, I think we need to start addressing some of those particular challenges. The second thing, of course, Governor Derito has raised the issue of resource flow to the counties. If we look at the amount of money that is held by some parastatal that is related to the county government, is a lot of money, and if that money were to be given to the counties would start having more money for service delivery. And I'm mentioning that simply because there is the costing of functions that has never been addressed fully, with a lot of commitment, and functions that are continuing to be carried out by regional authorities, the roads boards, and numerous others. The counties seem to be having challenges in delivery of services, and yet we need to recognize that transformation in each and every county adds to Kenya's GDP. The third point to make is that Bwana CS, and this is an apology I would like to make even before I make it, there are very few technocrats who think like you. There are many technocrats in government ministries, bureaucrats, sorry, who given authority and power, they would decentralize and go back to the central government because devolution has meant less powers for them and less resources for them, and no wonder they are holding to some of those particular functions. And this is what leads the governors feeling a little bit uneasy in this particular relationship.
Prof, you're making a very strong point, but I'm going to have to ask you to wrap it up. Let me give you another 30 seconds to make your final point, Professor.
I would like to say that also the governors are to blame because there are some governors who have continued to centralize in the counties. They are not going beyond to the sub-counties. Village counties have not even been established in all counties as we expect them. And finally, to mention here is that we tend to speak in many instances in a manner that leaves the county assemblies and the national parliament out of devolution space. We only bring them on board when we want to address certain crises, but it's the high time we started considering them as part and parcel of intergovernmental relations so that we can improve on these particular relationships. And it's my wish that what has happened during the crisis period can be replicated. And it's my wish also that the bureaucrats in national government ministries will start seeing that devolution is about building the entire Kenya. It's not about retaining powers and resources in order to have powers over the counties. There is no government that is...
Prof. Kanyenga, I will have to cut you off there. I know if we had more time, there's a lot more you could have said on this particular topic. Really bring into the fore the discussion about devolution. Is it possible that in certain sectors there was devolution in spirit, but not in function and resources? And could this be the gripe, the challenge that some governors face at a time like this? And of course, that brings us to the end of this topic, managing intergovernmental relations in a pandemic. But we could be getting some more words from some of the panelists in form of a Q&A session, which I'm coming to shortly. But before that, a previous topic we had within this same panel was on harnessing innovation in a pandemic, sustaining opportunities. I want to give the last speaker there an opportunity, Ben Roberts, who's the Vice Chair, ICT Sector Board, KEPSA, before we take some questions. Ben?
Hi, can you hear me now?
Loud and clear. Proceed.
Very good, thank you. Okay, so innovation is very much demonstrating the resilience of Kenya, and we've been talking for a long time about the Silicon Savannah and all this tech innovation that takes place in Ngong Road in Nairobi. But further down in Ngong Road now, in recent times, we've seen welders and carpenters making hospital beds and as well as eye-catching garden furniture. Universities all over Kenya, Dedan Kimathi and Kenyatta University making PPEs and ventilators. We've talked a lot about this. But what people have seen here, they've seen an opportunity for local value chain development. When international travel restrictions came in, this affected a lot of supply chains for imported goods, a wake-up call for people to invest in local manufacturing. And, that is what spurred people on to do these things. And we've also seen really in the digital space, a really fast tracking of the digital economy. And this is a global trend. The human adoption that's led us to move onto these digital platforms is happening in Kenya as well as everywhere else. I did write about this in early April about what's happening in Kenya. But with this transformation, we're seeing e-commerce, healthcare, and education being at the forefront of this digital pivot. But the World Economic Forum, they just reported that COVID-19 has accelerated e-commerce by 5 years globally. It's not moving as fast as that in Kenya. But we do need concerted efforts for implementation of the digital economy blueprint. And recently, there's just been a digital economy strategy, which is published on the Ministry of ICT website. We're going to have to fast track that as a nation and adopt fast. It's happening naturally anyway, but now we need to actually follow what's going on. We've obviously had a big demonstration of the ability to work from home. We're having many people on this call working from home, but it's not just about Zoom calls. It is about using ICT technologies for collaboration, digitizing your operations. Private sector companies like ours have been able to completely move everything online. Nobody is in the office whatsoever, digitizing everything down to signatures, digital signatures and documents. And I've been doing a lot of this, signing documents. So this is able to happen if companies that are further down the line with digital transformation have been able to move faster. KEPSA did a survey in May and June. 63% of businesses reported that they'd adopted the use of e-commerce and other online mobile technologies to get their business continuity going on. Obviously, some businesses like tourism, they're not been able to have continuity. But the demonstration of this working from home is that these jobs can be done from home. KEPSA has been working with the Ministry of ICT on the Jira Digital project since 2017. And this is to train and equip people for new online jobs and using their digital skills. This is what we're calling 21st century jobs. There's an increased demand everywhere and globally, but also in Kenya as well, for digital content, including entertainment services, online software solutions. People are able to run their businesses, completely from home and hosted purely in the cloud. This application that we're using today is hosted in the cloud. It's
okay, Ben, one more minute.
Okay, it's a major reason to invest in ICT infrastructure on the county level to reduce youth unemployment. But of key importance is digitization of all county and national government systems and sharing of data. We've heard a lot about that. Being able to use data for transparency and to make data-driven decision making. ICT infrastructure is all over Kenya, but as we roll out in rural areas, we've seen here the failure of ICT to be able to support a key thing like online learning. We've had to revert back to manual or broadcast platforms like TV and radio because we haven't got enough high-speed broadband in rural areas. But people have still been able to innovate. And in Bungoma County, an organization I've been working with was a virtual school. It's called Kibabi Virtual School in Bungoma County. They set up in a farmhouse. Some teachers were using mobile phones, set up using their mobile phones to do online lessons. This was supported by the county of Bungoma, and thanks to the governor, Wycliffe Wangamati, who supported this and put some of the local students through their program so they could have their online lessons.
Thank you, Ben. I am going to have to interrupt you there. Thank you so much. Unfortunately, we are out of time. We've had Ben Roberts there, Vice Chair, ICT Sector Board, Kenya Private Sector Alliance, speaking about really how to harness innovation during a pandemic. He's referred to promoting local value chains and supply chains, how to further invest in local manufacturing, and of course, that example that he was just wrapping up with on what he is seeing within Bungoma County. Part of a discussion within the wider discussion we've been having, the way forward, science and research, technology, innovation, and of course how county governments can better manage relations amongst themselves with the national government as well to ensure the best for their people during a pandemic. And I'm told we actually have one or two questions that we can get before we move to the closing or final part of this program. And I want to now allow at this time Governor Jackson Mandago, the governor of Uasin Gishu County, to pose his question. Governor. Governor Mandago, if you're on the line.
Thank you very much, Chair. I think my question.
Go ahead.
Yes, but I think my question has been overtaken. However, let me just actually in regard to financing counties. It was actually a comment to CS Finance and CS Devolution that as they are aware that funds have not been released to counties, I don't understand then how the CS Devolution and CS Finance are writing to us in counties to ask us to pay pending bills for Kenya Power and Lighting Company when we have not even paid salaries for the very staff that we are discussing as being our frontline staff and engaged in the fight against this pandemic. So I think as a matter of priority, we would expect that the National Treasury and even CS Devolution would be helping us get the funds to expand and continue in the fight against this pandemic, as we even address those pending bills of Kenya Power. And we are not just talking of pending bills for Kenya Power, because Kenya Power is not an exception. We are actually talking of addressing all pending bills of all suppliers who have supplied goods and services to county, because that again in effect has a direct effect in terms of the local economic recovery programs that we are looking at both as national and county governments. So the priority should be to actually make sure that we have the funds so that we continue with the fighting of the pandemic, but also ensuring that services are rendered in the county and save the few existing businessmen and women who are still surviving in the course of this pandemic by making sure that we release the funds for the services they have rendered. Thank you.
Okay, Governor, important question and one very central to the whole theme of managing relations at a time like this. You mentioned CS Devolution, CS Finance. I can give at least one of them 30 seconds to respond to that. It's something that has been raised on a public platform like this. CS Devolution, do we still have you on the line? CS Wamalwa?
Yes, sir. Thank you very much. As I said, the thorn issue of resources has always been there, and we are managing it through dialogue. Governor Mandago has raised a very valid point that my colleague CS Treasury is attending to. Thank you.
Okay, and because you've
go ahead,
CS Yatani. Go ahead.
Can I intervene? Yeah. So thank you very much. I think you agree with me that the governors that we've had exceptionally good working relationship. I know I've been a governor. I know how it was first term. The relation has really improved, and we've had a number of meetings on a number of issues. When there are situations that we always get together and try to hammer an understanding. And the engagement that has happened over the time has been exceptionally good. Regarding release of funds to the counties, we've been up to date. Of course, we were not able to disburse funds for June last financial year because of poor performance of revenue, but on the intervention of the president, and we were able to release, having sought necessary advice from the AG, we released that fund about 3-4 weeks ago. Regarding this financial year, all of us understand where the situation is, that we were able to push through the division of revenue through the National Assembly. It went very well. There was no acrimony. Even at the Budget and Economic Council, we had a very good relationship. Everyone understood our position, and we were able to have, a division of revenue without any challenge. The situation in Kara, we all know that is stuck at Senate, and they have a responsibility. We've tried to look within the law, even a Supreme Court decision that was made before, that we have no room to release that money, the resource for this financial year. We are now exploring other options. There is a window that will go back to the National Assembly and give us the room to spend 50% of the resource for this financial year. And that's now the matter which we are pursuing. And the National Assembly has been very receptive in the matter. And they've already set the motion to utilize that. But at the end of the day, I think we also need to realize that Senate or even the National Assembly, we all have a role to facilitate delivery of services to ensure that Kenyans do not suffer. The executive has done everything within its means to persuade and so that this matter can be sorted out amicably. But the ultimate responsibility lies with them. As soon as we have a Kara passed, even tomorrow, we release the funds immediately, and for the for the 2 months that are already lapsed. The good thing, with the county resources is that the money just is just the payment that may delay, but does not go anywhere. It will just be an accumulation of part of the resources. I also want to retrieve the position of Mandago, that over time we've also had a situation where the county assembly, the county government, have had their own challenges. You are provided with the resources, and yet you also do not, some counties do not fulfill. It's part of the obligation by failing to pay merchants, by failing to pay for critical, essential services. And at the end of the day, now we budget, and you have no authority to withhold your payments.
Okay.
But I think it's really important that these payments be sorted out. And I think our last circular is on the KPLC. KPLC has provided services both to the national government and also the county government. And if this payment is not done the next 1 month, unfortunately, they are going to disconnect, and they are doing with concurrence with also the county, with the national government, ourselves, because we've realized that there's no free service, and they are experiencing challenges, and we have to support them. And the same communication has gone to the ministries, and they are actually paying. We've also sent the same to the county government by also enlisting support of the CS devolution.
Okay.
Because this was a decision that was made in cabinet.
CS Yatani, I think you've made your point quite clear, and I believe Governor Mandago has heard your very direct response to some of the queries that he had today. And even though I have so many more questions to each of the panelists that have been a part, or each of the speakers that have been a part of panel 3, unfortunately, this is where we have to leave it.
Most of it. Now, I want to go to the resolutions of this conference that we have had today, and I want to tell you that these resolutions, we are going to take it up at the National COVID Conference that is anticipated to be held in the next 2 weeks as directed by His Excellency the President, and I'm sure at that conference, with what will be adopted there plus this, then we shall have points to move forward this country. Resolutions of the COVID-19 virtual conference held on Monday, the 31st August 2020. The COVID-19 virtual conference was convened by the Council of Governors on Monday, 31st August 2020, with an overall objective of reflecting on the government COVID-19 response efforts, challenges, and recommending strategic policy measures that can be adopted by both levels of government in readiness for future pandemics. In line with the conference theme, County Government Resilient in COVID-19 Era, reflecting on the past, building on sustainability for the future, the conference made the following resolution. Number 1, both levels of government to institutionalize the strong intergovernmental relations exhibited during the COVID-19 period by applying structural and transformative response towards future pandemics and all sectors of our national life. The action there, county government, Ministry of Health, Ministry of Devolution and Development Partners. Number 2, the national government and the county governments shall jointly develop a county post-COVID-19 socio-economic re-engineering and recovery strategy. Action, Council of Governors, National Treasury and UNTP. Number 3, both levels of government shall improve community health care response by operationalizing of health fund at county level with oversight through the health facility committees at the county. And number 2, ensuring community ownership in pandemic response. Action, county governments, Ministry of Health and Development Partner and civil society. Number 4, strengthening preparedness and response to pandemics through 1, establishment of regional infectious disease centers and research institutions by the county regional blocks and establishing of the Kenya Center for Disease Control, CDC, in order to strengthen national and local early warning systems. And 2, to investment by both levels of governments in preventive care. Action, county governments and Ministry of Health. Number 5, both levels of government to strengthen healthcare systems and fully roll out universal health coverage. Action, Ministry of Health, Parliament, and county governments. Number 6, strengthen accountability and actively fight corruption by both levels of government, embracing open government and publicize tenders awarded. Number 2, contracts on county, publicize contracts on county and national government websites. Number 3, ensuring agencies' tasks to fight corruption coordinate their work in order to minimize duplication, and that is the Senate, National Assembly, and anti-corruption agencies. Action, Parliament, County Assemblies, Ethics and Anti-Corruption Commission, Office of the Auditor General, and Director of Criminal Investigation. Number 7, both levels of government to work with health workers association in order to improve psychosocial support for frontline staff, survivors and families of those who contract COVID-19. Action, county governments and Ministry of Health. Number 8, both levels of government to build resilient food system by investing more in technology with respect to food production. Action, county government, Ministry of Agriculture and Development partners. Number 9, both levels of government to mainstream climate change within annual budgets to promote community resilience during pandemics. Action, county government, Ministry of Agriculture, Ministry of Water, Sanitation and Irrigation. Number 10, Public Health Act to be reviewed with a view to aligning it with the current constitutional dispensation. Action, Minister of Health, Council of Governors, Parliament, and Office of the Attorney General. Number 11, National Youth Service in anticipation of opening of schools to produce masks for all school-going children and all teachers. Action, Ministry of Public Service, Ministry of Education and County Government. Number 12, state agencies at the national level and county departments to strengthen their capacity to undertake rapid research synthesis mechanism and deliberately seek to harness local knowledge for decision making. Action, national government and county government. Number 13, Kenya National Bureau of Statistics and county department in charge of statistics to generate quality and usable data for evidence-based planning and budgeting. Action, KNBS and county government. Number 14, both levels of government to stimulate local manufacturing of COVID-19 commodities in order to meet the local demand, promote industrialization, and create job opportunities. Action, county government, Ministry of Industrialization, Trade and Enterprise Development, and private sector. Number 15, and which is the last one, the national government and the county governments to keep momentum of coordinating and collaborating in post-COVID-19 recovery period. Action, national government and county coordinated summit in the governmental sector forums. Your Excellency, ladies and gentlemen, those are the resolutions that we have come up with, and as mentioned, this will be scaled up to the national conference, COVID conference, that we anticipate to have in the near future. And we hope that this will be put together and be implemented collectively by the two levels of government. With those remarks, Your Excellency, ladies and gentlemen, it is now my pleasure to invite the Deputy President to make his remarks and thereafter invite you to close this conference.
Thank you very much, Chair, Council of Governors, Your Excellency, the President of the Republic of Kenya, Excellencies, Ambassadors, Your Excellencies, Governors, CSS present, ladies and gentlemen, good afternoon. And let me say I'm very delighted this afternoon to join in this timely conversation on progress made in tackling the COVID-19 global pandemic, not just in Kenya, but globally. This discussion brings to fore what we as a country has done, what devolved governments have done. And I want to take this very early opportunity to thank His Excellency the President for providing steadfast leadership in mobilizing both state and non-state actors at all levels of government in responding to this pandemic that has seen us as a country in a very coordinated response that has given us positive results that today we are now discussing the flattening of the curve. Your Excellency, admittedly, some very difficult decisions have had to be made with very far-reaching effects on many aspects of us as a nation. But it is also fair to say that citizens of our nation, in their majority, have responded to your call to take up the decisions that have been made and to comply with the regulations and protocols that have been established by government. Many people have had to change their lifestyles, and they have done so graciously, realizing that we are all in this together. I think it is also instructive to note that as we plowed through this pandemic, there are some three things, in my opinion, that have stood out. Number one is that counties, the fact that we are having today this conference on this national pandemic, the counties have actually proven that they are not only centers of decision-making, centers of new growth, but they have also become centers of solutions to our challenges. And I want to congratulate the county leadership, the governors, the county assemblies, the speakers, and all that have provided the necessary leadership for counties to bring their wealth of knowledge and experience in managing this pandemic. I think the other issue that has come out is, as the President said, we should move from tactical to strategic thinking and intervention. This pandemic has actually brought into focus the need for universal health coverage. That is part of the government's pillar on the future of our nation. If there was ever a justification that in fact the universal health coverage pillar is an idea whose time has come, it is now. That this pandemic is teaching us that while we can manage this pandemic using the interventions that are of an emergency nature, long-term solutions, however, provide a much more solid and much more a better framework for managing this pandemic. And maybe the third thing I would want to say is that the response by counties, TVET institutions, and private sector players to manufacture PPEs locally and other usables is a clear indication that our manufacturing program is a program that not only provides us the mechanism to solve our immediate problems, but it
Well, we seem to have a slight challenge there with the signal of His Excellency, the Deputy President, William Ruto. We will have him back on shortly. But obviously, he began by congratulating Kenyans for the manner in which they have handled the disruption brought about by the pandemic. He also moved on to talk about county leadership and just applauding the different innovative ways in which county governments have focused on dealing with the pandemic, dealing with the disruption to business, and empowering local entrepreneurs at the same time. And of course, really then highlighting why universal health care is not an option. It must be strengthened. And that is what he was speaking about at that moment, rather than just looking at dealing with a pandemic, but rather long-term what universal healthcare can do to make the lives of Kenyans better, to ensure that should another pandemic, God forbid, happen again, that Kenya would find itself at a different level in terms of how it dealt with it. I want to believe we have his signal back on, and let me hand back to His Excellency, the Deputy President, at this time. Okay, I believe we possibly still have a challenge with that. We should be having him back on shortly. But of course, just before the Deputy President came on, we know that the Chair of the Council of Governors was reading some resolutions that have come out of the deliberations, day of deliberations that this virtual conference has managed to convene, really experts from different fields to come and talk about county government's resilience in the COVID-19 era while reflecting on the past and building sustainability for the future. And of course, we know that His Excellency the President is on standby to speak just after the Deputy President to close this conference, probably emphasize on the recommendations that were made. Of course, the Chair of the Council of Governors, in some of the resolutions, I won't go through all of them, talked about how can both levels of government institutionalize strong intergovernmental relations exhibited during the COVID-19 pandemic, and moving forward, how can the national government and county governments jointly develop a county post-COVID strategy that is socio-economic, re-engineering, and of course, a recovery strategy as well. And there are about 15 of them. How can both levels of government also improve community health care, something very important at a time like this, operationalizing a health fund and ensuring community ownership in a pandemic response. Very important talking points at a time like this. And of course, one of the questions that came in that was very important was how can we move these recommendations to action, but also put in change management strategies, bearing in mind one of the speakers on one of the panels spoke about how certain sectors are averse to change. It takes a long time to change the mentalities of some of the players in key sectors. How can we ensure that we have change management strategies in place so that when new recommendations are brought, they're easily accepted, it's easy to transform, so that the story of a 3-year transformation can become a 3-month transformation as well. So those are some of the key talking points that have come out of this COVID-19 virtual conference, bearing in mind the Chair of the Council of Governors quickly tried to summarize some of the resolutions. And speaking of the Chair of Council of Governors, let me hand over to him at this time to take us to the next part of the program. Chairman Oparanya, over to you.
Yeah, thank you very much. It's unfortunate that we have lost the Deputy President, and now because he's not there, because of technology, I want to take this opportunity on behalf of the Council of Governors to invite His Excellency the President to close this conference.
Thank you, Governor Oparanya. And let me, at the very onset, just take this opportunity to thank you and indeed your entire council, all the governors and your secretariat for organizing what I believe to be a very important conference. And indeed, to thank you for the use of technology. We have not had to postpone your annual conference, as we heard from your Vice Chair, but rather through the use of technology, we have still been able to meet and deliberate as leaders and as stakeholders on how we have managed ourselves over the last 6 months, congratulated where we have done well, interrogated where maybe we have fallen short, but also put our thoughts together as to how we are going to be able to move our country forward, especially in terms of our preparedness to ensure that we're never able or we're never going to be caught off guard again. I think, Governor Oparanya, you have very ably summarized the outcomes of today's conference. I would only just want to emphasize a number of issues. One, the issue of a deepening of the partnership and the cooperation between the national and county governments, the realization that at the end of the day we serve one people, and at the end of the day we are one government with two levels, but one government serving one people, the people of the Republic of Kenya. And I personally want to really thank through you, Chair Governor Oparanya, the cooperation that we have had together from the very first day when we announced this particular pandemic to be a crisis in our country. We have collaborated very closely, and we have seen an impact as a result of that collaboration. That is something I believe we can deepen as we move forward and extend it not just to the healthcare sector, but also to agriculture and to all the other devolved areas. I believe that is something that we can continue to build on as we move into the future and to ensure that we are better able to serve our people. I think the second issue I really wanted to emphasize, that again came out in your resolutions, was the issue with regard to preventative health care. Without a doubt, we need as a country to re-engineer ourselves and to really focus on preventative health care. Not just wait for things to get to a critical stage, but to prevent them before they actually happen. This must be the focus, and this must be the base of our universal health care going forward. I think, governors, you will agree with me that as a result of some of the measures that we have taken during this particular COVID pandemic, we have seen a massive decline in waterborne diseases and the problems that have affected our people in the past as a result of cholera, bilharzia, and other waterborne diseases. All these issues related to cleanliness, we have seen a huge reduction in the number of cases that are being reported in our respective hospitals as a result of the actions that we have taken on COVID. So mine is to encourage us and to say that as we move forward, some of these positive measures that we have adopted during this pandemic should become the new normal, should become the new Kenya, should become the way we move forward. And we should incorporate and build upon these as we continue, as indeed was said, to strengthen our capacities, especially in our community workers, in our health workers at the grassroots levels, to be able to help us ensure that we are able to prevent before we need to get to the cure. The other issue that I think has come out very strongly in this conference is the need for us to once again refocus on mental health care. We have seen that this is becoming an increasing problem, as I have mentioned in the past, an increasing problem in our country, amongst our people, especially our young people. There is really a need for us to refocus our efforts and redouble the work that we're doing to help and to work with the mental health of our people. And towards this end, I really want to say that it is not just the relatives or the health workers, but it is the population at large. I mean, there has been a huge impact as a result of the lockdown that we have had on our young people who have felt restrained and constrained from the liberties that they know. And this has seriously affected the health and well-being of our young people. So I think that there is need for this, and there is need for a focus on this. And towards that end, without even waiting for the national conference, I do hereby direct the Ministry of Health to begin working on an active plan that they can present to us when we have our national conference on how we are going to deal with the issue of the mental health and mental well-being of our people. I think the other issue that has strongly come out is the issue of the need for transparency, especially with regard to procurement in our country. We have focused heavily on some of the issues that have been raised with regard to procurement in KEMSAR and others. But I think this, as indeed was said by some of the speakers earlier, is not an issue that is related just to the health sector, but indeed to all government procurement. At the national level, at the county level, in the judiciary, in the National Assembly and Parliament, we need to work together because we have the laws. What we need to have are the systems. And again, towards that end, I also hereby direct that the Ministry of Health, within the next 30 days, must come up with a transparent, open method and mechanism through which all tenders and procurement done by KEMSA are available online so that we can see who has been awarded a tender, we can see what is the value of that tender, we can see what was that tender for, we can see as they proceed, how was that tender evaluated, we can see how have people bid, we can see who was finally awarded. I think this level of transparency and through the use of technology will go a very long way towards ensuring that we have the confidence of our people, that those who are placed in institutions are able to manage the resources of the Kenyan taxpayer plus our development partners in an open and transparent manner. And I think this, as we start with the Ministry of Health, is something that we must move into all government departments, like I said, be they in the national government, the county government, or for that matter, in the various other arms of government. The Kenyan people have a right to know how their funds are being utilized. I think the other issue that came up, which I also just want to touch on, is the issue of preparedness. And preparedness is at all levels. I heard Governor Roba speak earlier about the fact that he was taken by surprise. Well, Governor Roba, you shouldn't be taken by surprise. Health is a devolved function as much as we partner together. You must also equally be ready, not just for COVID. You will have other issues that will be peculiar to your county, be they to do with foot and mouth, or other diseases that can move from animals to humans, be they polio, as a border county, coming from the border neighboring countries into our country. How will you manage at your own level? Be it those counties that have or are malaria prone, how will they be able to be ready to manage themselves to fight against malaria? It must be a partnership. Preparedness is not a national government function, it is a joint function of the government of the Republic of Kenya. And as I said earlier, the government is of 3 arms and 2 levels of government. But we are one government, and we must work together in order to ensure that our country is ready and prepared for any kind of disaster, be it a pandemic, be it terror, be it the health of our livestock, be it malaria.
So, on Sunday you went for
fire,
yesterday.
Thank you. I'm finishing if that's what your problem is.
Yeah. Which place are you going there?
Who am I talking to? Herbert Pa, somebody. Jamaza kidogo nimalize ile nasema. So like I'm saying, it is a responsibility that belongs to all of us. So I think the last thing that I wanted to say is that, as Governor Oparanya has said, and as I announced last week, we are intent on having a national conference where we shall review.
We were lucky as well, we saw.
And build upon the efforts that we have undertaken over the last 6 months. Where are we? How far have we come? And also use the opportunity to plan and to prepare Kenya's post-COVID action plan, which we hope to develop and work in close conjunction with all of you as we move forward. I just want to once again thank each and every one of you, thank the Council of Governors, thank all those who have been on the front line, thank all our partners, thank all our non-governmental organizations who have also partnered with us, and to say that we shall continue to work together, not only in combating and making sure that we defeat this virus, but also in building the Kenya that we want, a Kenya of shared prosperity, a Kenya that is open and transparent, a Kenya where her people enjoy her freedoms, her rights, and her liberties equally, regardless of where one comes from, regardless of one's gender, regardless of one's faith or color, that we are all children of one nation working together to build a great and prosperous nation for all. Thank you very much, Governor Oparanya. Thank you very much, governors. Thank you very much, partners. And with those few remarks, it is my great pleasure to finally declare this conference closed. Asanteni sana na Mungu awabariki nyote. Asanteni. Kwaheri ya kuonana.
Thank you very much. Before we disconnect, national anthem.